Hello everyone, let me introduce myself. I'm Yong Sze from Monash University, Malaysia. First of all, I'd like to thank the conference organizer for having me here today to present my work on the systematic review of emerging 5-fluorouracil nanotheranostic agents for cancer treatment. As you know, nanoparticles can be used as a drug delivery system to treat cancer due to several advantages as mentioned here. Interestingly, the utilizations of nanoparticle is not limited to treatment only. Nanotheranostic agents, in short term NTA, gain substantial interest due to the capability of nanoparticle to carry both therapeutic drugs as well as diagnostic agents in a single entity. In an ideal scenario, this combinations approach enables tumors to be assessed objectively for prognosis or diagnosis while the patient is still on chemotherapy. Nevertheless, its practical aspect must be validated before it could merit clinical trials. Therefore, it comes to the objective of this study to compile and compare the potential of different NTA in a systematic way by consolidating their in vivo efficacy, toxicity, and imaging capabilities. The literature search was conducted using Medline and Embase databases until March 18, 2022. Cancer, theranostics, nanoparticles, in vivo, and fluorouracils in combinations are the keywords to use for the search. Two independent reviewers performed the abstract and title screenings to include papers addressing these criteria. Firstly, it must be an original research papers involving 5-FU. We have chosen 5-FU as the model drug as this drug is still clinically relevant to treat solid tumors. Secondly, the research must involve the use of animal model. Thirdly, they have reported efficacy, toxicity, and diagnostic as the outcome. The data were extracted and analyzed. These figures illustrate the flow of study selections. After excluding the studies that does not meet the inclusion criteria, 9 studies were included in this qualitative analysis. This figure shows some general materials to construct NTA, and it can be categorized into fully organic, inorganic, and combinations of both. Let's talk about the efficacy. The efficacy of the free 5-FU has been enhanced with the use of nanoparticles in most of the studies. Interestingly, some NTAs are tailored to deliver extra treatment strategies such as thermal ablations, tumor targeting approach, or combinations of both. From here, we can find that thermal ablations is relatively more effective than tumor targeting and combinations therapy. Next, inorganic and organic diagnostic agent can be found in these studies, and MRI and NIRF were the most frequently used, followed by CT scans. Regardless of the imaging technique used in this study, the time for NTA to achieve optimal imaging was correlated with the targeting modality is either ligand or magnetic targeting. It can achieve a maximum tumor accumulation faster within 6 hours. Our data show that not all studies reported basic toxicity. Out of the 6 efficacy studies, only 2 studies reported on survival data, 4 reported on body weight change, and 1 provide the histological examinations. With the limited data that we have, we can see that NTA improves the survival up to 100% as compared to negative control. There is no sign of toxicity observed based on the body weight change and histological examinations. We have assessed the quality of the study's 2 camera checklists here and found out that the overall quality was low with medium score of 6. There are a lot of limitations from this study as well as mentioned here due to a wide variables and also over-reporting positive results. With that, we propose the Pecan checklist to assist in the refinement of the studies. These are the informations that we propose in the checklist, and you may scan the QR code for more. To the best of our knowledge, this is the first review that systematically summarized the potential use of NTA in animal cancer model. As a final point, I would like to emphasize that there are still limitations of the preclinical studies before they can use for clinical applications. Pecan checklists might be useful to assist in the refinement of the study design and ensure the study quality. With that, I end my presentations reviews, and these are the references.